well known in my clinic talking about a lot of acronyms, and I'll say that when we go to a petrol station, we have got three choices of fuel: octane 91, 95, 98. Obviously, we all know that octane 98 costs more, but if you have got an octane 98 lifestyle choices, chances are will be very, very good. And that's what we have to look into. Now, some of you have heard me in the last session. I put a lot of emphasis on the pH balance. I think Dipti was there in my workshop, which I did in Ghana 2 months back. It went on for 2 days. So these topics which I'm talking about are the workshops in itself. So please, if you're not able to understand, I feel sorry about it, but I'm happy to take questions about it. Now, when we are alkaline in our body, we actually support the electron transport chain. We actually create an environment where magnesium and zinc tends to block up NMDA receptors, and as a result, we can have increased retention of potassium, calcium, magnesium, increased intracellular uptake of magnesium, increased excretion of toxins, cortisols, and improved bone health and its serum endorphins. Now, about a few years back when I was into it, in one of the college sessions which I presented, I was told that pH balance of the blood is fine. Like, why you are so much worried about it? And that's what I said. You can read it. So, we are talking about not life and death, we are talking about health. Okay. So, pH balance of the blood not maintained will be dead, but if you want to maintain health, that's what we are talking about. So, we are talking about the pH of our intracellular spaces. That's what the key message is. So balancing type 2 nutrient is one of the another strategy. Now, I don't know whether recently one of my mentors from Australia came to, I think, Chennai or Bangalore, Dr. Ashley Berry, who did the training. So one of my, he was there last week. So Dr. Ashley Berry and his mentor, Prof. Mel Sidney Smith, has taught me this. Now, if one of the take-home message is that if you are balancing type 2 nutrients, and these type 2 nutrients are protein, zinc, sulfur, essential amino acid, magnesium, phosphorus, potassium, they have to be replenished simultaneously. You can't do it one by one. It has the system is designed in such a way that all family has to go together in a bus, otherwise bus will not go. Okay. Now, this is a very important thing which you can all do if you know to calculate the protein metabolic index, especially if your patients are inflamed. Because if your patients are not in an anabolic state, which is ideally should be 3, then we have a problem. So you can have it with this calculation of creatine multiplied by albumin divided by urea multiplied by uric acid multiplied by 1000. So you will get this number and see how you work out the calculation. This was a method which was taught to me by Prof. Mel Sidney Smith. Now, copper-zinc ratio is a very important aspect. We talked about copper raised in the cancers, but also copper has got a very important role in the anxiety disorder. Any females who are on oral contraceptive pill, and again a clinical, ask them first question, are they taking oral contraceptive pills? If they are taking oral contraceptive pills, very, very likely chance there is a copper-zinc imbalance. Copper is a good conductor of electricity when it is in the cables. It is a good conductor of nerves and emotions when it is in the body in the higher amount. High estrogen levels enhances copper. So we need to have this balance maintained. Zinc role in depression is very well known, and this is something we have to manage as well. Now, serum uric acid, again, a very raised serum uric acid is another biochemical marker if a depressive patient can become bipolar. Again, very important clinical marker as well because we don't have any markers like that. Now, another thing which is important is the Gilbert syndrome in mental health. Now, we always think that there's nothing much to do about it, but if the high bilirubin levels are there, then it increases the neuroinflammation. So, last what I would ask is, do you all think there's a need for integrative psychiatry practice? And I think if you do, please share these words with your psychiatrist colleague, and happy to be contacted if there is any issues. I've got tons of references whenever I'm talking about it. And this is the last thing which I would say is that change always begins within. So please try that, because if you guys, those who are new to this area, started being skeptic about what you have been taught, as Sir has said about Harrison having so many mistakes, I think we have to be bold enough, because today some of these editorial boards comes up. Now, Dr. Saxena talked about Dr. Pisano. Dr. Pisano and Dr. Alex Vasquez, V-A-S-Q-U-E-Z, has written a book, Inflammatory Master. It's a very book thick volume. Both of them have actually published editorial mismanagement in JAMA, Lancet, who are the most notorious journals to publish nutrition supportive articles, but they will always be publishing nutritional anti-friendly articles, which means anything which, and they have said that whatever is the conclusion, the abstracts have been elicited wrong. Now, Dr. Shrikant was here, and he was talking about that he was very feeling unfortunate that that they published the study, but now nobody acknowledged them. It takes 17 years. Anything which is published today takes 17 years to reach clinician's desk, that to 25%. So what I would say to him is whatever he did will reach the clinician's desk in 100 years. So I think we should still be hopeful.
So you want us to publish or not?
we should. So what happens is that platform like this will be fast forwarding studies which are done. Now, this is an initiative of Kana movement, which is Brighter Minds. If you have got kids, grandkids, please give them a gift of a lifetime of training these young brains, where you were talking about subconscious mind can be trained till 7 years. Any kids from 5 to 15 can go through this brain training exercises programs offered by Heartfulness Movement, which can change their life. Thank you.
Perfect. Great talk, as usual, Sanjeev. This is really great. I just give it to now. It's Sunita is going to talk about a case study which she has done, and you can understand what are the importance of hormones doing here. Sunita, all yours.
Thank you. You said time is money, so I have to go like a real express train before you derail me, okay? Sorry, I don't have a PPT because I thought I could use my flashcards instead. Okay, so I'll get on to it. So about 2.5 years ago, this 48-year-old patient presented to me with the following symptoms. She'd come with her husband, and her husband looked, and she was sitting in front of me with a total deadpan expression on her face, totally disinterested in everything. Her husband looked at me and said, "Doctor, can you please do something for my wife? She sits the whole day totally demotivated, not interested in anything, has no sexual desire. Can you help me?" I mean, even if I bought her the biggest diamond in the world, and those were the exact words to me, she would not have any reaction. So I just internally smiled, and I said, I know, I can help her. Okay, and this is how I went about helping her. So she's presented to me. She had attained menopause about 1.5 years ago, and she had the classic symptoms of menopause, which were hot flashes, night sweats, insomnia, brain fog, difficulty in remembering things, loss of energy, loss of focus, lots of hair fall, saggy skin, anxiety, and depression. Now, she also had a history of PCOS, diabetes, hypertension, hyperlipidemia, and also hypothyroidism, and as well as anxiety and depression. I'm only going to focus on what the important things are so that I can give you the whole picture. So she was currently on medicines for all the above conditions, including 2 antidepressants and 1 anti-anxiety drug. Her family history showed that both her parents had suffered from coronary artery disease. So she had a very strong family history. The blood work which I got done, I'm only talking to you about the ones that are out of range. Hemoglobin was low. For each blood work, you have to correlate and understand that it's related. Everything in the body is related. So her hemoglobin was low. That gave me a clue that maybe you know, that would affect her thyroid, which would affect her progesterone production. Her fasting blood sugar was a little high. HbA1c was 6.8, serum insulin fasting was also a little high, SGPT, SGOT also high. I have to rely on your imagination to form a little picture of this woman. HDL was low, 44, LDL was 136, which is slightly higher, triglycerides were 200, apolipoprotein B 130, lipose small a 75, vitamin D very low, 12.7, and vitamin B was also very low. So she was the classic case of metabolic syndrome, where her blood pressure was slightly raised, sugar was raised, triglycerides raised, she had a bit of central adiposity. So this was her in altogether. Then I did her hormonal studies, which showed her cortisol was high at 14, anything above 10 is high. Her E2 was low, estrogen was 32, progesterone was only 0.2 nanograms per dl, free testosterone was also very low, 0.3, DHEAS was 100, which was also low. Now normally in women who are PCOD, they have a high testosterone and they also have high DHEAS, okay? But so we don't normally treat them, but in this case she was menopausal and she had both these parameters were low, okay? And her free T3 was also a little low, free T4, TSH were normal, like the sick sign syndrome. So her T3 was a little low, her sex hormone binding globulin was also a little low. On BMD showed osteopenia in certain areas of osteoporosis. Her mammography, USG of the abdomen for her uterus and ovaries were normal, her pap smear was normal, and it just, all that the abdomen showed was a mild fatty liver. Okay, now how did I treat her? Of course, first with lifestyle modification, her stress, diet, exercise, weight loss, and sleep. Very important. Lifestyle factors are very important if you want to holistically treat a patient. Vitamins and supplements, the multivitamin, as Dr. Sanjeev mentioned, copper is very important, so is zinc. Vitamin B12, of course, we all know what that role that plays. Remember, her husband was very concerned about her depression and anxiety, which wasn't really getting under control. Vitamin D, we all know